Hi, everybody. It is Jane Rachel, and I'm here today with Dr. Stefanie Vuotto, who is an assistant professor of psychology at the College of Mount St. Vincent. She's also a licensed psychologist who sees both children and adults in her clinical practice, and she's got a research interest concerning the long-term side effects of childhood cancer survivorship. And she's completed a 2-year fellowship at St. Jude's Children's Hospital in this area. So she's incredibly talented researcher with all of these credentials. But on top of that, I am very lucky to call her a friend. And she's someone that I don't get to see quite enough. But that said, I've always felt very close to in my heart. So
Thank you,
in
Jane.
addition, yeah, thank you just so much for being here. And in addition to these like amazing academic educational background, she's also got an inspiring story of her own of how she is a survivor of childhood cancer. So, Steph, before we get into I want to hear all about your research and your work at St. Jude because it is also impressive. But first, can you just tell me a little bit, and I know it's wide open-ended, but just a little bit about your story of surviving cancer in childhood?
Of course. I am a two-time childhood cancer survivor. When I was about 11 years old, I started to have terrible symptoms, um, fevers, night sweats, chills, fatigue, not feeling myself. And I wasn't presenting with the usual symptoms of the cancer that I had. So it took the doctors a little while to figure out what it was. It ended up being a stage 4 lymphoma. I remember very well, I was rehearsing for the Nutcracker, the ballet in New York, and I was on stage, and I think I passed out or something happened that night. I think my mom, had to put me in an ice bath because my fever reached like 106, and she had been taking me to
Wow.
the doctors like nonstop, looking at CAT scans, figuring out blood work. What is it? It wasn't until they finally, did some imaging tests that they figured out that I had stage 4 lymphoma because I wasn't presenting the typical presentation with a mass in the neck. So it took them a while to figure it out, which, probably is what led to the second cancer, because when you are stage 4, and this was in like 96, when you're stage 4, you're going to require a more intense treatment regimen. And so I had, surgery. They removed my spleen. They did exploratory surgery where they removed other masses in my, uh,
Wow.
thoracic and abdominal cavities. I had radiation to the chest and abdomen. I had about a year of chemotherapy.
Wow. And you were
Very
11?
I was really young, and it
Wow.
was devastating. I had to obviously stop attending school and had to give up ballet because my bones were going to be weak. I had to give up figure skating. So it really, was very challenging. The chemo usually would make me not only feel very sick, but then I would get fevers. And when you have a fever, you have to go inpatient and wait till the fever goes away before you can start the next chemo. And so it was quite an ordeal. But I had a lot of support from my family. My mother was a fantastic advocate for me. And so, I ended up being cured of that cancer, which was wonderful. And it was about a year and a half later, in like holidays 1997, when one of my routine blood tests came back showing that my platelet count was very low. And they were thinking maybe I was myelodysplasic. They weren't sure. And my mom had, read something where, low platelet count's not a good sign. There might be something going on here. And she was really pushing and pressuring my oncologist to do a bone marrow on me. And he was like, this is ridiculous. We never do this. There's no need for this. This is an unnecessary procedure. But she insisted, and he, knowing that what she'd been through, was like, for your peace of mind, we'll do it. And lo and behold, there they were, these little baby leukemic cells that were actually biphenotypical in nature. So they were part ALL and part AML. So ALL is, acute lymphocytic or lymphoblastic leukemia. AML is acute myelogenous leukemia. And that had they never really seen that in a patient with Hodgkin's. So we learned later on that it was that intense chemo from the first cancer that, caused the second cancer. And really at that point, all we could do was treat it very aggressively. They consulted Dr. Pui at St. Jude, who is one of the pioneers in childhood cancer research, about how to go about this. And they decided to treat it as if it were AML, which is the more aggressive of the two leukemias in childhood. So that treatment regimen included a bone marrow transplant. So I had induction chemo, total body irradiation, and a bone marrow transplant.
Oh my gosh.
So we're
Wow.
very fortunate that my little sister was a perfect match for the bone marrow.
Wow.
And I was very
That's,
lucky. I was the only person in Mount Sinai in that unit to survive those 3 months.
oh my gosh. So first, to make sure I understand. So it wasn't even like it was a relapse. You got a whole brand new cancer,
They
right?
call it they call it a secondary malignant neoplasm. It's not a relapse. The first cancer was gone, but the chemo from the first cancer caused this leukemia.
Is that like common, or is that
And that's sort of what I worked on at St. Jude. Well, not me specifically, but in our department of cancer epidemiology, they sort of track these long-term side effects to see, after how much and what kind of chemo are we at risk for different kinds of late effects.
I mean, it's so interesting and such an inspiring story. And one of the things that's theme on my website is that either patients or a patient's parent, if you're talking about a child, needs to advocate, because your mom sounds like she was on top of things, and if she wasn't, who knows what could have happened, right? It's
Absolutely. It's one of the most important things a parent can do. It's what I always, tell parents when I talk to them about this. My mom kept a little black book, a little like binder, one of those 5-star binders with like a little Velcro, and she just wrote everything down. And she would go back and say, but no, 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 on this date, you did this. And, really keep track of everything.
because you think, they're the doctors, they're the oncologists, but no one cares as much about your life as you, or your mother or father. So it's really important. To like, that's the whole theme of my website. And I think, at some point maybe I need to interview her mom, because it sounds like she had
Yeah, she
a
really.
huge role of that. So how many years did the two cancers go on for? What was 11 to what age?
So it started like fall of 95 through about 1998. So,
So,
roughly 2.5 years.
and very
Um,
pivotal, crucial years as far as growing up
Very,
goes.
very crucial years from a developmental perspective. It really, childhood cancer and many childhood illnesses, they arrest development. You literally, you kind of pause when you go into this. And then by the time it's over and you're, in high school, it's like, well, wait, I'm still functioning like a 10-year-old. I didn't really
Yeah,
get to socialize or go through any of those
yeah.
pivotal, formative years of,
We've talked about that, how, but just you and I, where just showing up in high school without really having gone through the middle school experience, it was very traumatic and very difficult.
very.
And I don't
A lot of
know, maybe,
catching up to do.
yeah, absolutely. And so when this started at 11, I mean, you're so super smart. So you probably, my guess is you knew fully what was going on, right? Like, you were how aware of you
I
of
did. By and large, different psychologists and different hospitals have different ideas about what appropriate ages are. I think usually around 8 years old, children cognitively are in a place where they can process information like this. Certainly by 11, I was able to, when you're 11, you've heard the word cancer before. You know what it is. You know that it's scary. You know it's bad. It wasn't quite clear to me um, how life threatening my cancer was. I think that wasn't really, I didn't really think that I was going to die at any point when, you know, I told you I was the only person who survived bone marrow transplant that February in Mount Sinai's transplant unit. So, it's definitely a lot, but you're more concerned about the things that you care about at that age, which are peers. What are my friends going to think? Am I going to have to not see my friends anymore? I had to have this giant surgery, so I'm going to have this big scar down my stomach. How am I going to look in a bathing suit when I'm a teenager? These are the losing your hair. These are sort of the more proximal
Yeah.
issues that you're really preoccupied with at that age,
That is
which is
so interesting because I was wondering that, like, how much are you like, because an adult I think would be focusing mostly on like, am I going to live? Am I going to die? What are the statistics? What are the odds? But you really were more focused on like, what does this mean for me socially? And what, right? Um,
yeah,
and,
absolutely.
and
And it
how,
changes as you get older. I've seen cases where you have um, young people 16, 17, 18 years old who I can think of one example in particular of this young man who had just sort of figured out what he wanted to do. He wanted to be a social worker and he had this great plan. And because his cancer had gone into remission, and as he was coming to these, coming of age realizations and figuring out his identity and what he was going to do, his cancer came back and he was so angry because he knew that like this was going to be it. And he had just figured out what his life plan was, so
oh,
very,
well,
very tragic. But different ages, sort of, you're in a different place from a psychosocial and a developmental perspective, and so
and
different things are on your mind.
do you think the adults around you were aware of that? Like, were there doctors and psychologists who made sure that you were getting developmentally appropriate either social services, or were they helping you manage that?
Yeah, there's usually always a multidisciplinary care team involved, even today, more so today probably. Psychologist, social worker, the physicians, nurses are all of the above. Um,
Yeah.
they're great. Now, one of the things I don't like about the model today is you're seeing a lot more. So NPs and PAs are taking on more responsibilities, which is a little scary, I think sometimes.
In what way?
I don't know. I think so. My PA managed my follow up care after my first cancer. And I think, that I imagine that the oncologists were, coming in to kind of check in and make sure everything was okay. But really, I was just under her care. And at the end of the day, it's a different training model. Not to
Yep.
say that PAs are not capable of doing what they do. Of course they
Yeah.
are.
Yeah.
But I'm trained for what I can do, and I wouldn't want to step beyond that.
So, despite, I mean, this kind of harrowing but amazing experience because you survived, did it just, I would imagine it wasn't like, okay, you're all better now and just go on with life. Like, right? I mean, is that what happened? You're just all better? And what kind of effects did that have on you, either psychologically or medically or?
Absolutely. So this is a really big, this was a problem when I finished up in the mid to late 90s. The model kind of was like, well, you're cured. So, come back for your scans, but you can kind of go back to your regular doctor now. And that really doesn't work. And so I remember my mom actually was talking with one of the nurse practitioners at our hospital and said, there needs to be some sort of like, post graduation clinic or something for us, because I'm still petrified. You told me, my daughter could go septic if she gets a fever because she doesn't have a spleen. Like, I need someone who's going to help me manage this after we leave, the oncology clinic. And so that's when the LTFU model really started to develop. That's the long-term follow-up clinic model, where you have a designated space with, an oncologist who specializes in late effects, and even, your nurse practitioners or your social workers, your psychologists, who are all there to deal with sort of the aftermath of cancer and help you coordinate with your specialist, your GP, because, young people, it's just a lot of young people do not have it in them to go for all of, to keep track by themselves of
Yeah.
all of the late effects that they're going to have to deal with. I have a cardiologist, an endocrinologist, I have a pulmonologist, I have a lot of ologists that I have to help me throughout my teens and 20s and 30s deal with the late effects of my treatment. And so the LTFU clinic is kind of like a centralized hub for that.
That's
So
great. So
that's
it's now
great.
20 is a good segue to present life. You're now, it's what, over 20 years ago, right? Since you've been completely cancer free.
Oh yeah, 25. Yeah.
25. Okay. And what kind of effects does it have on your life today? Because I think people usually think like, okay, once like as soon as that happened at 16, it's over. You're better. You're cured. It's done. But it sounds like that's not the case. That you have a lot of doctors and a
That
lot of
is not the
care.
case. And I can speak to that both personally and professionally. On a personal level, as I mentioned, I have so many late effects, medical effects, psychosocial effects, that I have to kind of deal with. So, psychologically, you just have to kind of process the trauma, because when you're in the trauma, anyone who's been through a traumatic experience knows that you're really just focused on getting through the
Yeah,
trauma, right?
surviving. Yeah,
Then you're out of it, and now it's time to process it and to integrate it into your identity. And that was one of the things that I really liked about one of the first studies I did on this. As a grad student, I collected data from 100 young adult cancer survivors, and I used Dan McAdams' life story interview to kind of use personal narratives to understand more about their psychological adjustment. And what I found in that study was that the people who looked back on their cancer experience and were able to integrate, so they when they I had them recount positive high points, negative low points, turning points, and the ones that were able to take those negative low points and sort of find meaning and purpose in them and integrate it into their identities were scored the most favorably on our psychological adjustment measures.
that's
um,
interesting. That's so interesting. Can you give an example of like what that looks like, a low point, and how they were able to
Trying to think of
integrate that?
one. Yeah, we had, you know, uh, a young person talk about one night when she almost died and had to be rushed to the hospital, and she was utterly petrified, and she actually passed out in the ambulance, and it was really hard for her to recall that night and almost dying. And she looks back and she remembers kind of having this out of body experience where she actually was kind of in the corner of the room and in the corner of the car on the way to the hospital with her parents, looking down and watching her parents. So this was sort of how she was experiencing it. And she looked back on it and she was like, this was a pivotal point in my life where I was going to either succumb to this or come through. And um, she, the way that she recounted it for her was very meaningful and kind of infused new meaning and purpose into her surviving that night. So that's just one example. There are all different kinds of examples of people who can inject purpose and meaning into all of it.
And is there a way, so if you're a parent of a child who's going through this now or has recently, gotten over or I guess recovered from cancer, is there a way to help so that they're more on the scale of being able to do that than not? Like, does therapy help? Like, what helps? I guess the question is the odds of it affecting them more positively than negatively in their adult life?
In their adult life, yeah. So certainly I think it's important to talk, to check in with the young person during and after the cancer experience. I think narrative therapy is a really great approach to use with cancer patients and cancer survivors, where you use the art of storytelling to kind of, as I said, inject meaning and purpose into something like this. So, what was it all for, right? Why did this have to happen to me? Now all these hardships in my life because of cancer are making my life harder. What does it all mean? Why did I have to go through this? So as you tell that story and you find purpose and meaning in it, because maybe it inspired you to go into this line of work, or maybe it helps you to not sweat the small stuff and appreciate what really matters in life, or maybe you had these opportunities afforded to you as a cancer survivor via going to special camps or make-a-wish trips, or other opportunities, grants, scholarships, writing opportunities, speaking engagements. I did a lot of public speaking for cancer nonprofits. That helps me. I sort of was empowered because I was telling my story. And that eventually led me to study this in my professional work and do this in my professional work. So helping people kind of find and connect how their, misfortune has also this silver lining.
Do you think back when you were a child, did the field do enough? I think when you were recovered from the cancer to help you adjust to the rest of like to high school and to the rest of your life and to prepare you for the future? Or was it really like you're done now?
Yeah, the psychological services generally ended after, you're finished with treatment. You, of course, my mother did take me to a psychologist, and I saw her once a week for a couple of years. And finally, she said to my mom, Grace, she's not ready to talk about this. She's putting up a wall. She's still kind of processing it and just wants to be a teenager for a little while. And then of course, after that, I was ready. So certainly taking your child to, to a therapist, but being prepared either way, whether they're ready to talk about it or not, it's okay. You don't want to force people when they're not ready before they're ready. But certainly the social workers were great when I was there. I think one of the great things I've realized about social workers is that they wear many hats. This particular social worker was willing to use faith with my parents, which not everyone is comfortable doing. I think it's important as a clinician to kind of assess who your patients are, what's going to help them, and if appropriate, and if you happen to have something in common like faith, then that's an appropriate and great tool to use. Why wouldn't you? And so that sort of shared experience really carried my mother through some of the low points of my cancer experience.
Yeah, I mean, your mother sounds like absolutely such a hero in the story, especially like pushing for you and fighting for you every step of the way. Although I know that you also have siblings, so it wasn't even like you were the only child. So they were also trying to take care of, raise two younger children at the moment. So that's probably a whole interview in and of itself.
It is. Cancer does not happen in a vacuum, right? So, I mean, one of the things we see that's very interesting is marriages are more likely to fail after something like this. It strains the marriage. There's no time for building intimacy and closeness between two people when you are just losing your mind over what's happening to your child. Siblings completely can feel discarded, pushed to the side. It's just it is what it is. But you're right. That's a whole other interview.
That's a whole other day. We might have to bring.
But important to be mindful of when you're a parent. That you have to kind of keep everything going while your head and heart are here.
Yeah, and I mean, it's important that your parents got the support they needed too, because they certainly had it.
Which they weren't.
Yeah.
Grandparents and so forth. Yeah.
Oh, yeah, absolutely. A little bit about the medical effects now, because you said you don't have a spleen. There's still, you survived the cancer, but what does it mean medically for you now and the rest of your life?
Absolutely. So it's actually been a little tricky for me because when I worked in the Department of Cancer Epidemiology at St. Jude, I was really more so than ever before in my life, very intimately acquainted with and working every day with statistics and data surrounding the late effects of treatment. So in other words, if you had X amount dosage of this chemo, via intravenous or intrathecally or whatever, it can result in this so many years later. So I was able to kind of create a profile for myself and have a more realistic understanding of what I was dealing with. And it's sort of what I'm seeing now. Anthracycline's very cardiotoxic chemotherapy drug took a toll on my heart. And I have to see my cardiologist. I take my statin. I have my medications. That's very important, especially now as I'm considering family building, not being able to maybe safely carry a pregnancy. It's very draining on the heart. And so that's obviously a huge devastation not to be able to do that. It's also financially devastating, which I'll just say cancer is financially devastating. But there are organizations out there dedicated to helping people with that. Certainly the risk of cancer, again, I know I'm at risk for breast cancer. I know I have lots of endocrinopathies. So I take different hormones to help kind of assist with different endocrine functioning. Pulmonary issues, I have a decreased lung capacity. I have, it's everyone's always like, you need to exercise for your heart. But, for me to run around the block, it uses up twice as much oxygen as for the next person. And then, of course, just like other side effects, you know, uh, anxiety sometimes, when you have cranial radiation to the brain, every day I'm paranoid that I'm struggling with word finding and I'm having issues cognitively, but I have to remember that I'm also just getting older and we're living in a pandemic. So it might be that
Yeah.
as well. But, chemo brain is a real thing. A lot of people, well, that's more when you're on chemo, but there are definitely neurocognitive late effects of having certain chemo drugs like high dose methotrexate or being exposed to cranial radiation, like I said, corticosteroids that can impact your cognitive functioning.
That said, you've overcome all of that because you are just one of the most brilliant people I know who's got a PhD in psychology and all of that, and is doing amazing work in research and teaching. But as you're speaking, I'm thinking, like, I know you and I know how uber competent you are, but not everybody, like, I'm just wondering how the average person handles all of this, right? Like, you're just innately uber organized and all of that. So is there help for someone, your average person going through this? Who helps keep track of that for all of them?
Yes, absolutely. Especially so if we're talking about school-aged kids, you really need to, there should be some kind of other health impairment, i.e., your classification on an IEP to kind of help get the services in place for those children because they very well may need accommodations and services in school to help just, equalize and level the playing field. Um,
But what
you know,
about an adulthood, just keeping track of all the different doctors and all of the different issues? Like, can they still continue to receive help? Is
Yes. But they have access to the same resources really that the rest of us do. The American Cancer Association does have some resources for survivors. There are certainly organizations I know of, nonprofits that work with survivors. The SAM Fund comes to mind, a great organization that issues small grants to young adult and adult cancer survivors who are just set back from cancer and who need a little bit of financial help. I would say finding your local long-term follow-up clinic beginning in, from really the end of treatment. So through adolescence, 20s, 30s, 40s, throughout life, many of them see patients for life. They're not going to see you for your common cold every week, but they're going to help you kind of centralize all of the resources you need. So my LTFU gives me a binder with, all the different specialists I have, the contact info,
right.
sends me updates, here's what you had, here were the treatments you received, here are the risk factors, here's how often you should be getting breast sonograms or, echocardiograms or whatever it is, just to monitor for all these late effects.
That's great. And I think, are things at all getting any easier? Like, you were experiencing this as a child in the 90s, but for a child today, I remember you once telling me that there wasn't enough support right when you finished the cancer treatment. Are there more? And I think I remember you also telling me in the past too that it was hard when you were approaching adolescence because a lot of things were so child focused. Are they doing right? So a teenager with cancer is going through something different than a child with cancer. Has the field grown to address those needs today, would you say?
I think it has. I do. I think there's a lot more attention to all the supportive care needs of this population. I know, for example, that now like fertility preservation in adolescence is huge. If your child is going through this, you need to find out. I think Livestrong actually, there's some like financing available too for that, to kind of ensure that. But in terms of psychosocial functioning, there are resources, but it's also like anything else, it's on you as either patient or patient advocate to kind of, find those resources, gain access to them, make the most of them. No one comes to you and says, here's what you need to do. You really do have to advocate for yourself or for your loved one.
I think, the last question, and I think you just touched on it. I wanted to end on advice for either parents whose children are going through this now, meaning they're recovered from cancer, but they still, they've just recovered, or even a young person or child. I mean, I think your story in and of itself, you went through all of this, and then you ended up getting a PhD in psychology and doing research in the field. That in itself should give people hope and inspiration. But anything else you want to add to either a young person just dealing with this now or a parent?
Yeah, I mean, I think a lot of the things I talked about are important. So you really have to advocate for your own health, right? There's not someone out there who's worried about how healthy you are as you get older. I mean, your doctors care, of course, but you have to go see them. And when
Yep.
they tell you you have to stop smoking and you have to exercise and get some, cardio every, twice, 3 times a week, you have to do it. And when you have to go get your scans, it's annoying. I hate taking medications. I hate fighting with my insurance company to negotiate for, the medications I need every day. I've been taking 6, 7 pills a day since I'm 10 years old. But I have to do it because if I don't do it, who's going to pay the price, right? It's going to be me. So, you have to kind of, if you're a parent, you want to sort of help train your child to advocate for themselves, to learn how to navigate all of this. Um, to learn how to pick up the phone and cold call an insurance company and fight with them until you get what you want. So that's so important. You do that with your child until they're able to do it themselves. Staying organized, of course, helps. Find your local long-term follow-up clinic. They're going to be a great resource to you and help you kind of get the information that you need. And then, just in addition to just self-advocacy and advocacy, you know, like you always say, Jane, you really need to make time to check in with yourself. How
Yes.
are you? Are
Yes.
you coping with this okay? Are there needs that you have that are not being met? Um, that's okay. You've been through something just terrible. It's a very traumatic, long experience. It doesn't really end. When it ends, it affects the rest of our life, sometimes in good ways, sometimes in not so good ways, but being mindful of that and really taking care of your body and your soul and your spirit.
Wow. What, like, it's just a perfect way to end. I think there's so many things, though. I think we have to do this again because talking about the siblings and the parents and, surrogacy, there's a lot of other issues that I think we should touch on. But just,
Absolutely.
but I think this is really helpful for other people who may be experiencing this. And it goes along with everything that I've said, that you've got to be your own advocate, or the parent has got to be an advocate. And I think, huge kudos to your mother for, if she
Yes.
wasn't by your side, so just,
Yeah, I definitely credit her with saving my life as much as my doctors.
yeah. So that is amazing. And we need to finish this discussion, but thank you so
Thank
much.
you so much for having me, Jane. It's been great.
It's been great.